Ani. So hi everybody, welcome. Thank you so much for coming virtually to our second Virtual Parent Academy. Today we're going to talk about sleep, as Ani mentioned. And as she also mentioned, my name is Courtney Kowalchuk. I'm a therapist who has been doing these classes with the district for probably about 10 years now. And yeah, this is kind of the latest iteration, and we do 10 classes over the course of the like spring and quarter or spring semester. And yeah, so we're on number two. There will be eight more, and Ani has a list of those. Typically, she puts those in the chat. She's also going to put the PDF version of the presentation in the chat. And at the very end, she has an evaluation, a course evaluation for you guys as well, to just let us know how we're doing or how we could improve, what you like about the courses, what you don't like. And we do love to get that information. It's really helpful because after all, these are for you guys. Um, so Ani mentioned if you want to comment or ask questions, feel free to do that. You can turn your mic on when you're ready. Otherwise, we hope that those stay muted just for everybody's privacy and for the recording to kind of go smoothly. And if you don't feel comfortable using your mic, you can always put stuff in the chat. I do check that throughout the presentation. And I do welcome questions because I think that that's kind of the most important part, and other people might have the same question that you have. So I find also that we learn a lot from parents when they're asking questions, or other parents can give suggestions or strategies that work for them, and that's really helpful too. Okay, so we'll go ahead and jump in. Tonight we're talking about sleep and sleep hygiene, which is the way that people in my world we like to word basically why sleep is important and how to help your kids get better sleep. And we're going to specifically talk about children and adolescents. I try to give a full range with kids, from 0 all the way to 18, and just give you guys a lot of information in the next 2 hours. And so there should be a little bit of information for everybody and for every age of child. I like to start with just a little quick information about me and perhaps why you should listen to me, or, what qualifies me as giving you credible information. Like I said, my name is Courtney. Thank you so much for coming. One of my passions in my work is parenting, and I work and have worked with parents for just under 15 years. I'm a clinical and board certified therapist. I have specialized in working with kids and adolescents, particularly from the lens of trauma and with parenting. Some of my experience, you guys are probably familiar with Rady Children's Hospital. I worked with them for several years. That's where I got licensed. I've worked with the different San Diego County school districts, primarily North County, Vista, Oceanside. We've worked with Fallbrook, San Marcos. So I have a lot of experience in this area. I've worked in inpatient and outpatient residential clinics and served in the U.S. Air Force. And the certification here for me that's most important to highlight in this realm is that I have been certified and trained as a positive discipline parent and teacher educator, which is just kind of another, it's a method of parenting. And I've went through specific training to train parents and educators on how to either be better parents or improve your parenting, or how to implement specific strategies in schools and in classrooms. So that's about it. If you guys have any questions, feel free to ask. We'll go ahead and kind of jump off. And normally, what I like to do is to kind of get conversation going. Is I like to ask either start with a quote or ask a question of you guys, and just kind of get a vibe of like who's here and what kind of um, problems you guys may have with sleep with your adolescents, or how your kids may be struggling or not with sleep. So I like to start by asking a question. And my question tonight is a pretty straightforward one. And that is, how well are your kids sleeping? And that might be they're sleeping well or they're sleeping not well. And feel free to share that either in the chat, or you can speak out and just kind of give us your impression. What I will say to start off that conversation is that there is a wealth of evidence that suggests that children and adolescents, primarily adolescents, chronically experience decreased sleep, reduced sleep. So not enough sleep. We've got one parent kind of already saying that they are not sleep, their child's not sleeping enough. So we've got some younger families co-sleeping still. Take a while to fall asleep and then sleep deep, have a hard time waking up for early school. Okay, so maybe the student sleeps well, but you don't. I hope there will be some information in here for you as well. For those of you that did answer or did share a little bit, let's see, there's got some more people responding. Two daughters sleep about 7 to 9 hours. Good. Oh, that sounds great. Anxiety. So we have some families with anxiety. Takes longer to fall asleep. Depends on sports practice. It's difficult to have a consistent bedtime schedule. Definitely with kids who are in sports, I can understand they're doing things after school, and that's going to kind of create hiccups, create waves. And I think we've had people in the past, and I've had a particular parent that I can remember talk about this. Their kids did sports, and they're kind of going through all listening to all this information, and it's like, well, what do I do? Like either they can be in sports or they can get good sleep. And I think what you have to do is you just kind of have to decide for your family, do they get more out of sports, being in sports and engaged in sports? Is there more of a benefit there, right? Is it worth the risk of less sleep during the season? And that's a parenting choice that you have to make and just decide using your best judgment. And I think also then you just do what you can on the days that you have. Okay, we have some families where their kids are night owls, and we'll really get into that. There's at least two parents so far that mention this, kind of getting to sleep is a challenge, and yet sleep quality seems okay most of the time. School buses pick kids up really early, absolutely. That can be so hard because of transportation, right? If the school bus is picking them up, they all have to make it work with however many kids they're picking up, and that certainly makes their day earlier. Um, and that's going to be harder because it would mean earlier bedtimes for kids. Sports and homework. So kids are busy, makes it challenging for them to go to sleep. So I hear like lots of demands on kids too, make it challenging to sleep. Thank you, everybody, for responding and giving your input. This is really helpful. My hope is that there will be points for each of your kids in each of your situations. And if there's not, you can certainly feel free to put me on the spot and ask me near the end if we don't get to your specific situation. Okay. So I hear a lot of parents identifying that their kids are getting less than what they should, probably. Whether that's because of certain factors like sports or homework or the bus, or it's things like kids being night owls or the quality of their sleep or waking up. So, like environment. But I think what you guys are telling us really coincides with the research, which does indicate that kids get less sleep than they need to. And obviously, we're going to go into why it's so important that we work towards better sleep and work towards more, so like quantity and quality of sleep for kids. And that's leads us to one of our primary objectives, which is we really want to tonight, I want to help you guys identify how sleep is the foundation for health and learning. And I want you guys to be educated on how sleep impacts your child's brain development. And those kind of go hand in hand, right? Learning how that's the foundation and how this either positive or negative sleep impacts the brain development. And I think the most important parts are helping you guys learn ways to improve sleep for your child and get understanding on how to set them up with better sleep hygiene. You certainly are going to get answers. So if you guys have specific questions, I am here for you guys for the next 2 hours. And so if you have any questions, don't hesitate to ask. I do even stop in middle of a slide and I'll answer a question because I do believe it's really important. And sometimes for me, giving you guys the answers that you need outweighs the importance of my presentation and how, smoothly that goes. So please don't hesitate to ask questions. Okay. So we're going to go ahead and jump in, and we're going to hit those first 2 points in the next couple of slides. And we're really going to talk about what is appropriate sleep? How do we even know if our kids are getting reduced sleep, like the studies suggest? The reality is that the sleep needs vary by age. And I also want to preface this whole conversation that I'm coming from the expertise of mental health and from a psychiatry perspective. And so really just what that means is you can certainly always, it's always recommended that you talk to your child's doctor if there's a really significant or severe issue with sleep. And yet, the reality is that sleep is a pretty foundational part of our mental health. And so, I do have that expertise to talk about sleep in this way. And it really has been kind of a passion of mine to help people get better sleep and help kids get better sleep because we realize how much it affects our mental health on a day-to-day basis. So, with that little disclaimer, how much sleep is normal for kids? Sometimes people don't know. Parents ask these questions. And the reality is, infants and babies from 0 to 3 need between 14 and 17 hours of sleep. It's a lot. I think you guys probably remember the newborn stage, babies sleep a ton. On the next slide, I'll have a chart that you can pretty much just screenshot if you'd like. And it's going to give all of this in a really succinct way. I will argue the chart is a little bit, there's a couple of parts that I wish the source had a little bit of more stringence in the answer in the graph given, and I'll explain that on the next slide. So, infants from 0 to 3, 14 to 17 hours of sleep. Babies and toddlers from 4 months to 2 years need between 11 and 14 hours of sleep. And naps really vary. And so, but from child to child. And the reality is you kind of have to get to know your own child, right? Does my child kind of sleep on the longer end, maybe 14 hours, 13 hours, or do I have a child that tends to sleep less? This is also a good thing to remember from if you have an older child, can you remember back when your kid was a baby or a toddler? How was their sleep then? Were they a child that tended to sleep more? This can kind of be an indicator as they get older what their threshold might be for sleep. And so just kind of keep that in the back of your mind. A really great resource for younger kids, specifically babies and toddlers. There's a resource called Taking Care of Babies The woman's name is Kara, and it's kind of like the name is a play on her name. She is a pediatric sleep specialist. She was a neonatal nurse, and her husband is a doctor. She's really kind of honed in on this market of younger kids and sleep. There's a free blog, and she has an Instagram where she gives tons of answers to questions. When I first became a mom and my kids were babies, that really was helpful to me. So if you have a younger child and you're having trouble with sleep, you can look into taking care of babies. She does have courses, and those there's a cost to those, but I think the blog and the Instagram, you could probably get all the answers to your questions there. And I think that's a really cost-effective way to do it. School age, which is probably most of what we have here, parents of school age kids. Um, we, the general recommendation is 8 to 10 hours. And for a school age kid under teen, right, they're going to need a little bit more. They might be more on the 9 to 10 hour. Teens, we really recommend 9 hours. That's kind of the magic number for most kids. Um, for a lot of people, that sounds like a lot. For some people, it might not sound like enough. And so remember, I see adults, so like 18-year-old kids. I still call them kids. I don't know, do we call them adults or kids? 18-year-olds who still sleep for 12 hours. So it really is, and that's kind of their threshold. That's the best, um, amount for them in particular. And we also look at other mental health concerns and whether kids have other mental health needs. Sometimes the sleep threshold is higher for those kids. They need more sleep. I did list an article here that you can look into as part of your resource where we're getting these numbers from. So if it's a struggle for you to be like, whoa, 8 to 10 hours, that sounds like way too much, definitely check out this article and it does go more into depth about where we get these numbers from in terms of a biological, physiological standpoint. Here is that lovely chart that I mentioned that you can screenshot. This kind of gives you the age group, the age, and the recommended daily sleep, kind of all in one place for everybody. The only real issue I see with this particular chart is down when it gets to an adult. Um, it's listing it as 7 or more hours for 18 to 60. And I don't really agree with that. I think that when we're saying 7 or more hours, okay, what does that mean? I would say even adults, the research shows that adults need between 8 and 10 hours of sleep. So it should look the same as a teen. Um, we might have a lot of parents that are like, oh my gosh, I don't remember the last time I got 8 hours of sleep, or I'm sleeping 5 or 6, or I think there's a lot of individual variance to these numbers. And so it's important to kind of recognize that. The reasoning for these numbers really comes from what the data supports and at what point do we or our children start feeling like there's a deficit? And mainly we're going to look at cognitive deficits. When we're not getting enough sleep, at what point do we start seeing cognitive differences? And so that's how they come up with these numbers. And so we looked at newborns, infants, toddlers, anywhere from 12 to 17, 12 to 18 hours. Preschool age, 10 to 13 hours, including naps. I would say a lot of kids are kind of not napping between 4 and 5 years old. You might have a kid who's that old and still naps, but I would say that the norm is that they're kind of dropping their naps by that age. 6 to 12, by that age, there's no naps. We'll kind of get to that too. They're sleeping from 9 to 12 hours, which I think even as we hit 13, 14, 15, kids might still need that 11, 12 hour, but the recommended range is 8 to 10 as teenagers, 13 to 17. And when we talk about adults, 18 to however long we live, right? I think that the magic number there is between 8 and 9 hours. And so if you can do well with 8, That's excellent. If you need 9, I find that actually there's some research that supports women need more sleep than men. And we tend to do better cognitively, behaviorally, physiologically with a little bit more sleep. And so if you find that, maybe your partner only needs 7 or 8, you need 8 or 9, at also fairly, it coincides with the research. Okay. So if you guys were able to screenshot that, you can keep it with you and just kind of use that as a guide. I will say again, remind yourself that there is individual variance to those numbers. And yet, the important thing to get out of that is finding out how much sleep works for your child and when you start to see behavioral, cognitive type of deficits. Whether you notice that if your child's only getting 6 hours or 7 hours, there's likely to be some behavioral challenges because they're simply not getting enough sleep. They're not rested. And you're going to want to kind of do that research, use your best judgment. I would argue, kids are really going to make it known. You'll know when they're not getting great sleep. Um, and so the reason why we really want to prioritize these, what I consider higher numbers, right? 9, we're going to kind of say moving forward is the magic number. The reality is that sleep is the foundation, right? And we're going to start getting into, I think we had a question constitutes a cognitive problem. So we'll kind of go into that. I think the person's name is Music Minister. It's just probably a name, but I'm going to go into that. Really, that might look like practically for you. If there's a cognitive deficit, you might notice that your kid is not as focused. They are maybe having some academic problems. Maybe their grades are going down, right? Those kind of thing might constitute a cognitive problem. And the reality is like just kind of trying to gauge whether you can tell, is that from sleep? Are they getting enough sleep? Are they getting quality sleep? Um, and that's kind of what we're referencing when we talk about cognitive deficits or cognitive problems. Um, and it'll go into that on the next slides. And so hopefully we kind of go more in depth and answer your question even better. Um, so sleep is the foundation, right? Like I said in the first slide, 25 to 50% of children and adolescents experience some sort of sleep issue during their childhood. That's a lot of kids. So we're going to say like half of kids experience some sort of sleep issue. I think that this presentation is not necessarily geared towards adults, but one of the most common things that I help people deal with is sleep. And so I think that that's pretty common, right? In just human beings. We experience some sort of sleep issues probably about 50% of the time, or it's the likelihood is 50% in our lifetime to experience some sort of sleep issue. Um, We'll talk about more on the next slide how sleep is the foundation and what this actually looks like from a brain perspective. But we know that sleep deprivation, this lack of sleep, that's we're finding is really common in 50% of our kids. Um, it can cause cognitive impairment, right? These kind of bullet points that we have up here. One of the main things, and this was part of that cognitive deficit or cognitive problem. So it means kids they have reduced attention when they're not getting enough sleep. Their memory, they're having issues with their working memory, their decision-making abilities. Right? So you might have kids who are very forgetful. They can't pay attention or sustain attention in class. You're getting notes home from the teachers. Okay, they are really not paying attention, right? Some of this stuff we're going to get into later, some of it can look like ADHD, right? If we have a pretty significant sleep deprived kid, some of these behaviors and things are going to look like that. So we might start there, right? If we have a kid who is not able to pay attention, they're not remembering things. They might have mood disturbances, right? If they're sleep deprived, kids who this kind of 50% of kids or adolescents that are experiencing this sort of sleep issue also have an increased risk of anxiety and depression. And so you might notice just behavioral, mood or affect issues, right? You might notice that they're not themselves. You might notice that they're more irritable. You might notice that they're more nervous or worried about things, more fearful, more on edge. Physical health problems, we know the data supports this. Sleep deprivation it causes higher risk of obesity, diabetes, heart disease. And this is more so when we start talking about like if this problem continues into adulthood. Um, Accidents, right? We know that sleep deprivation it can cause us to have increased risk of accidents due to impaired alertness. Our ability to pay attention is affected. And so when we're talking about kids, right? If we look at this from a standpoint of, okay, how is this so important? How is this the foundation? This makes it pretty clear, right? Okay, if a kid's not getting good sleep, they're not able to pay attention at school, they're not able to memorize or lock into the things that they're learning, right? That's that key to learning memory, attention, decision making, right? Their alertness, their energy levels, all of these things are key to learning, right? So if they're not able to sleep, they're not able to learn. And that's pretty much their primary role as kids right now is we're expecting them to learn, right? We're expecting them to go to school, sit through those classes, retain that information, move on to the next building block and continue that for their entire adolescence in school, right? And so we talk specifically about physical health and mental health. These things are incredibly impaired by sleep, and if kids are sleep deprived, these are some of the most important things that we start to notice, right? And so I would just kind of pay attention if you're noticing kind of dramatic shifts in mood, if you're noticing any physical health concerns, if you're noticing that your child is just really not performing at school, these are going to kind of be key indicators that maybe there's something going on with sleep. And if you can kind of plug that in and go, yep, I know they're not getting good sleep because they're staying up late, they're waking up early, then it's going to be kind of like oh, okay, this all fits in. This is the puzzle piece that has kind of been there, but we haven't really recognized. And that's what this is, right? Is this kind of letting us know this is the foundation for kids. And we kind of have to start here because all these other things can't get better without that nice solid foundation. So I hope that helped answer that last question that we had, going into a little bit more about the cognitive deficits. We're gonna go a little bit further, right? A lot of people, I think so originally I had the last slide where we talked a little bit about sleep deprivation, then it's like, hey, wait a minute, what is sleep deprivation? What do we classify as sleep deprivation? Really, the way that we define deprivation is if a kid is not consistently meeting sleep recommendations. And that can be if you go back and look at your chart, right? You go and you look at wherever your kid is in age and you look at those hours. On average, is your child consistently meeting those recommendations, right? And that's a question that you have to answer. And if you don't know, I would also encourage you, and this will be in part of the strategies later, you're going to want to start logging. We're going to do some sleep logs for our kids. And I'll get to that when we get a little bit later in the slides. So, sleep deprivation is when your child or your adolescent is consistently not meeting those sleep recommendations. Typically, there are visible symptoms in kids when they are sleep deprived or when they are consistently not getting enough sleep. One of the first one I think that I most often see, and one that anecdotally parents talk to me the most often about, it is behavioral problems, right? And I kind of lump hyperactivity into behavioral problems. Hyperactivity, you guys have seen this in kids. It's often mistaken for ADHD. And so, if we don't have a really good either sleep study or really good sleep logs before kids are diagnosed with ADHD, we really want to accomplish that. We really, if you're having a kid that's struggling with hyperactivity and people are saying, oh, maybe it's ADHD, maybe it's this, he's looking like he can't pay attention, he can't focus, he's not alert, or he doesn't want to engage, he can't remember things. Let's look at sleep first, and then we kind of go to these other diagnostic things. Now, of course, the diagnostic is a part that's where the clinicians or the physicians come in, the pediatrician, things like that. However, as a parent, you can become very informed and say, okay, wait a minute, we're talking about ADHD and he's got some of, he or she has some of these symptoms, but I know he's getting really poor sleep, right? So let's kind of fix that issue, see if some of these other things start to clear up or improve. And then we're not mistaking these things or misdiagnosing these things. And I think it's really key and really important for parents to have that knowledge and that power to say, wait a minute, I don't know if it's this. Let's kind of let's look and see if it could be this other thing, right? This could be the root cause. So we do see that very often. Kids that are struggling to sleep or not getting enough sleep, there's a lot of hyperactivity, and it would kind of seem that that would be counterintuitive that a kid who's sleepy would not be hyperactive. And it's just not the case, right? The brain doesn't work that way, and it particularly doesn't work that way for all kids. And so you might actually see what looks to be this opposite effect, where a kid is really hyperactive. We're definitely going to see behavioral problems. We see a marked increase in irritability and aggression. And so, what I would also encourage you is to separate this. Is there increased irritability with everybody, right? Not necessarily just you, or not just a sibling, or not just dad, not just, grandparents. We want to look at, is there increased irritability across the board? Aggression, mood swings, and impulsivity, again, all kind of sometimes, mistaken for ADHD or other mental health diagnoses. But what we want to do is, can we notice that there's a correlation between a period of time where they got less sleep or whether they were struggling with sleep, and we kind of are noticing some of these more, externalizing behaviors, irritability, aggression towards others, really marked like changes, swift changes in mood, really impulsive behaviors. Now, what we also have to remember is, to a degree, kids have these types of behaviors anyway because of the development of their brain. Kids are inherently more impulsive. They have inherently less emotional regulation and control. So some degree of this is kind of typical, we would say. And when it starts to get atypical is when you look at your child and you notice this is kind of markedly different than he was, 6 months ago or a year ago or 3 months ago. It's kind of be your gauge. Um, One of the other things is learning difficulties. We talked a little bit about this in the previous slide where we were talking about cognitive deficits, right? Impaired attention, trouble concentrating, memory issues, poor academic performance. Their grades are going down. They're not able to remember or retain what they've learned or the things that you're telling them. And we start to notice this fall in their cognitive performance. Physical signs, so some kids that are not getting enough sleep are going to wake up and complain that they have headaches. They might be ill more often, right? When we're not getting sleep, we know that that affects immune function. So we could look at that as a possible symptom or kind of correlative issue, right? When kids are getting sick more often, you might feel like they're sick all the time. And really, we talk about more why, right? Sleep is restorative, sleep is the foundation, and it affects every part of our body, both our physical or our cognitive, mental health, our immune function. And so you might notice this too about yourself, right? A lot of people get sick when they travel or when they're really overwhelmed or burned out at work because our defense is low, right? We're getting less sleep. Sometimes even one night of not getting good sleep can put your immune function, at a lower impaired position. And then we pick up whatever the kids have, or we pick up something at work. And you might be able to kind of notice that about yourself too. Snoring and mouth breathing are some symptoms. We talk about kids who have trouble with breathing during sleep. Sometimes either that's either a cause or a symptom, right, of sleep issue. And that's something that typically we would recommend the pediatrician check out. Talk to the pediatrician. You can do a sleep study, and some of those things can kind of be caught early. And those physical signs are usually just indicators that something's going on. Long-term risks, we talk about if kids are consistently not meeting sleep recommendations, and then those kind of they happen long term into adulthood or young adulthood. We talk about obesity, diabetes, poor mental health outcomes, impaired cognitive development, so the actual development of the brain and cognition. We talk about obviously increased risk of injury and things like that because of the alertness, all of those things. I think if anyone can think back to a time in your life, parent's life, child's life, where sleep has really been an issue, you kind of start noticing a lot of these things, right? It starts to affect everything. Um, and so usually when I see people in my own practice, one of the first things I'm looking at is what does your sleep look like? How can we tackle that first if there's some issues there? Because nothing else is really going to improve much without us focusing on the sleep issue. Okay. So this was kind of what I was mentioning in the last slide when we started talking about why sleep is so crucial, particularly for kids, but also for us. There are four critical functions of sleep, and these are the reasons why sleep is so important and why we offer an entire class on it in the Virtual Parent Academy. One of the most important critical functions of sleep is that it's a period of restoration. As many of you probably know, when we sleep and you go into REM sleep, those are the periods of time in which the body repairs, right? Your body will repair tissue, your body can repair muscle, your body promotes all that good immune function where your body fights sicknesses and colds, flu symptoms. Um, all of those things. We talk about restoration when we talk about the critical function of sleep because this is the primary function. It allows your body to heal itself. And so, if we're not doing that, right, if we're not getting the recommended amount, then that just means restoration is not happening. And so, whether some of you have seen in your kids get sick, okay, they need lots of sleep. They need lots of extra rest. For us too, we might need to sleep extra, right? A couple hours extra. You might fall asleep on the couch. You might spend the whole day sleeping. The reality is that your body needs that time to repair the tissue, repair the immune function, increase all of the things that our body has from a biological standpoint to fight all of that stuff off. So if there is no restoration, we're looking at kind of a decrease in functioning biologically or physiologically. We also, in the psychiatric realm, we talk a lot about the critical function of sleep means memory consolidation. And that means the organization and consolidation of memories, right? And so, one of the most important things about this is when we talk about stress, things that are happening in our lives, right? That are difficult, challenging, promote they bring about negative emotion in our life. The consolidation of those things is incredibly important. How the brain consolidates memories is the foundation of our emotional regulation, which is the next point. If we can't consolidate memories, our brain can't consolidate memories appropriately, emotional regulation takes a hit. And so, an example I can give you guys is one of the things I've said this before that one of my specialties and expertise is trauma. And when we have something that traumatic happens to the brain, whether it's your child or whether it's you, the reason why people typically get things like nightmares, recurrent memories, recurrent triggering thoughts of the traumatic event is because the memory consolidation has been disrupted. Trauma naturally disrupts the memory consolidation efforts in the brain. And so what happens then is those memories are not properly stored, and then they come out in different scenarios, situations, ways that they normally wouldn't if they had been consolidated properly, right? And so the kind of nature of a traumatic event is that it's not going to be consolidated properly because it's not typical to the brain. Now, when we take a step further and we're not sleeping well, memory consolidation is not working at its best. And so then what we have is this further implication. This is why anxiety, depression, mental health concerns get worse when we're not sleeping because of this principle of memory consolidation. When we have things that are kind of all out of whack, they're not stored where they're supposed to be, we get more of these feelings of worry, fear, nervousness, right? Sadness, melancholy, all of those things are more prominent, right? Things are not getting organized and consolidated in the right way. And so we have this lessened ability to emotionally regulate, causing some of these other things. One of the things that we talked about um, in that conversation of memory consolidation is our ability to emotionally regulate. If we're not sleeping, the third kind of critical function of that is we our brain manages stress, it reduces stress in sleep, and it stabilizes emotions, right? How many times have you guys had an argument or you've had a falling out with someone or you've argued with your spouse or your partner and it's like, okay, we just need to sleep, right? We just need to sleep on it. And we need to wait, we're all upset. I've cried, I'm upset, whatever the case may be. Something happens, maybe your child gets upset, and it's like, let's sleep, right? Let's all go to bed. We'll wake up in the morning. Everybody will feel a little bit better. The reality is that sleep action actually has restorative functions for our stress levels. When we're getting appropriate sleep, cortisol levels are managed better by the body. And without going too much into a rabbit hole about that, the reality is just that cortisol does not function as well when sleep is really optimal. So, as sleep goes down, cortisol, which is the stress hormone, increases. It's the same with exercise when we're moving our body, right? That physical health component, which is the fourth critical function. When we have better heart health, when we exercise, when we move, when we sleep well, these things are directly affected. And so if we're not sleeping, our physical health also is in jeopardy, right? We have poorer heart health, we have typically slower metabolism. We talked about links to diabetes and obesity and hormonal imbalance. And so part of what's happening in that restorative function of sleep, it's managing these different parts of our health, right? Clearing out some of our hormonal pathways, making sure that things are balanced and managed, repairing cells in the heart, repairing the function of our metabolism, our endocrine glands, all of these things that kind of work together to keep our physical health optimal. And that's why people start really noticing when they're not sleeping, they start having physical health concerns. And so we're going to kind of jump in and talk a little bit about we talked about sleep being the foundation for your kids, and I want to help you guys kind of understand uh, the crucial components that sleep have. It's affecting brain development, and brain development is kind of everything for kids. When we talk about kids from a clinical standpoint, we're going to focus in on brain development. How is their brain developing over the course of their childhood? Because really, that's our foundation, right? As adults, our brain is one of the most important, if not the most important, um, thing in our body. And so, how has that developed over the course of our childhood? And sleep is pretty crucial in the context of brain development, and we'll kind of go into why. I did share a research study here. If anyone wants to go deeper in that, the link is here in the presentation, and it talks more about how sleep affects brain development even deeper than what we're going to talk about here. But the reality is that the amount of sleep, the quality of sleep, and the consistency of sleep that our kids get is directly correlated with the brain functioning, specifically in regions for self-control, specifically for learning, specifically for emotional reactivity and reward processing. So when we look at this kind of you know, self-control, learning, emotional reactivity, and reward processing, which reward processing, let's kind of call that a behavioral component, right? How kids are motivated to do the things that they're supposed to do, right? Within their brain, within the context of the brain. Really, what we're looking at is all of that equals how much sleep they're getting, right? We'll kind of simplify it like that. The amount, the quality, and the consistency of their sleep is directly correlated with that brain functioning in those regions. And so if we look at like what our kids' tasks are, right? What's our kids' job? Right now, our kids' job is to control themselves and to learn, right? They're supposed to go to school. They got to do, their assignments. They're supposed to control themselves, their behavior, and those are kind of their basics, right? And so this is why this is so crucial for brain development and why it's so crucial of a conversation to have, because we will see lower academic achievement in school, right? With the self-control and the learning. We'll see marked behavioral issues in school with the emotional reactivity, the lack of self-control or impulse control, and their motivation, right? And so what that means is we see dramatic shifts in kids, particularly in their academic achievement, when they're not getting enough sleep, when they're not getting quality sleep, when they're not getting consistent sleep. And so you've, of course, attended a talk on sleep, and so that's all we're going to talk about tonight. And so it might feel like I'm kind of foot stomping this thing, and at the same time, I think some parents, we kind of like, oh, like they'll adjust and they'll be okay. Like I'm kind of doing fine. And while that's true, because kids are incredibly adaptive and resilient, we talked about resiliency last week or 2 weeks ago. Um, the reality is that we don't want to kind of set them up for failure by not really foot stomping sleep when we're at home. And so a couple of parents mentioned this. This is part of the brain development conversation when we talk about puberty and kids of specific ages. Um, Really what's happening is there was a couple of parents that mentioned, well, my kid's kind of a night owl. And the other one said, my student really struggles with falling asleep. This is not abnormal. It's very typical for kids who are either, typically it's post-puberty, puberty and post-puberty, where they really start to struggle because there's this biological sleep delay that happens and it starts in puberty. And so you're going to see that it's harder for your adolescents to fall asleep before 11 p.m., right? They biologically, physiologically are adopting this night owl circadian rhythm. And so sometimes this is kind of an aha moment for a lot of parents where it's like, This is why, right? They're not just being difficult. They're not just being, angsty teens. The reality is that this is a biological marker. It happens to every child who goes through puberty. It will be harder for them to fall asleep before 11. And the reality is we really just have to do what we can and try to set up good sleep hygiene because what that means is it'll just be a little bit harder for their bodies to fall asleep. I put in a study specifically about this night owl circadian rhythm that happens. So if you really want to kind of like geek out and go all into it, it's there. Um, but my hope in sharing this information is that if you have a child who's kind of adopting this night owl thing, just know that, there's nothing wrong with them. They're not trying to be difficult. There's nothing wrong with you and it's normal, right? It's typical, it's normal, it's very common. And the reality is we do what we can, like I said, with sleep hygiene and some of the tips that I'll share in the second half of the presentation to help them better fall asleep, to make that a little bit easier. Because if we do nothing, right, then that circadian rhythm kind of goes where it goes. If we shape the environment, right, we give them some tools, we cut out certain things that could worsen that rhythm or worsen their sleep hygiene. We certainly can make an impact because I have absolutely seen, adolescents fall asleep before 11. It just requires a little bit of extra fine tuning. So we call psychosocial factors. Those also impact sleep, leading to cognitive function deficits. So we talk about things like your child's tendency to socialize, right? Especially at night, if they're socializing on screens, if they're socializing on their computer or on their phones. Um, some of the other factors might be the academic demands or studying. What's their workload like? We talked a little bit about social media, tech, phone, internet access use. Those are all parts of, are they using it to socialize? Are they using it for entertainment? How much are they getting at night? These are absolutely part of the psychosocial factors that will impact sleep. And what we also look at is that there's data that suggests that these psychosocial factors, these different things, right, it can increase those intermittent wakings. So I had a couple of parents mention that, their kids get to sleep, but then they're waking up frequently. Those are what we call intermittent wakings. And really, what that means is this could be an issue. Is there screen use? Is there, intense studying or academic pressures that are happening before bed? How often? What does that look like for your particular kid? And this could be one of the factors that we look at, right? We know that this can increase those wakings, and so there's going to be strategies that we adopt to decrease that. Thanks, Annie. She put the research study in the chat if you guys are interested. Okay, so I'm kind of heavy on research. So to kind of round out that conversation, and the conversation on why this is so important, this biological component, the physiological components of why sleep is so important, why it's the foundation. Insufficient sleep or, right, sleep deprivation. It's also associated with alterations in neural functioning. And this is when we start talking about the brain, right? And how this really impacts the brain, particularly of kids and adolescents. So we talk about cognitive control, and this is really getting super into it, right? Poor self-sleep quality is associated with less dorsolateral prefrontal cortex activation, which is all that nice stuff in the front, right? This is a long, long way of saying the prefrontal cortex, which is what I call the secretary of the brain, right? It's all that decision making, the long-term concept, looking at long-term consequences, emotional regulation, impulse control, all of that nice I've got this, right? The secretary, the thing in charge, the person in charge. This is incredibly, this is linked to insufficient sleep, okay? So we know that people who get have poor sleep quality or less sleep are going to have issues with their prefrontal cortex, right? This is incredibly important because what we see is specifically in kids, we see it in adults as well. But what that means is kids who take greater risks. When they're under stress, kids are more likely to take bigger risks or just more often take more risks. And what we also see is the um, reward centers of the brain, how kids' brains perceive doing what they're supposed to be doing, right? Motivation, doing the activities that they're supposed to do, getting the dopamine rewards, all of that is impacted when they get reduced sleep. And so I'm sure you guys have heard a lot about, well, maybe and maybe not, dopamine sickness and how our phones are messing with the reward systems of our brains. Sleep does this too. And so I think some of us, we kind of have a double whammy. I know I deal with it because I use my phone too much, and I'm the first person to admit that. The reality is that when kids are getting less sleep, right, this dopamine system of the brain is affected, which means we are less likely to do those things that get rewards, right, in an appropriate way, and it starts becoming it's not working right, right? It becomes dysfunctional. And that's kind of what this whole slide is about. It's basically just giving us all that kind of science and data information that we need to support these ideas that dopamine is largely affected when we're not sleeping well. um, Kids become they have less, prefrontal cortex activation, which means their secretary of their brain is not working as well. And we look at greater risk taking with these types of things. And these are all behaviors where it might click and be like, whoa, I'm noticing these kids, my teenager, or, this is really happening with my school age kid. This is really happening for my elementary age kid. And hopefully those things click and we can really, find strategies and ways to help them fix this. Um, yeah, so we're going to kind of jump into things that impact kids' sleep. So we've talked a lot about like, what are the risks? Why is this a foundation? How does this help brain development? Now we're going to talk about, okay, what are things that are possibly impacting your kids' sleep? What are some of the concerns? If you've got some, you can go ahead and share them. This is the slide where we basically talk about some of the things that cause or impact sleep. And so the first thing that we talk about is exactly what I was talking about when I talked about puberty, right? Biology impacts their sleep. When kids hit a certain age, that natural circadian rhythm changes and they're more likely to have disturbed sleep just naturally. Okay. So some of this is it's like, it's not our fault. We didn't do anything to change that. It's a part of biology. Um, there's various theories on why this circadian rhythm thing happens as kids get older, right? When we think about like cave people us that long ago, it would have made sense for there to be more people looking out, keeping watch, keeping safe, right? And so that is one of the theories as to why our biology changes when we're in that critical stage of development for kids. And so we could kind of talk about those theories and why. I think the more important conversation is just knowing that this is a part of our kids changing bodies. And we can have this conversation with our kids. Hey, look, your body is doing what it's kind of gonna do, right? And we can't completely alter that. We can't, it's not like you're lazy and you're a problem and there's an issue with you. It's not that. It's that biologically you are changing, your body's changing, and we just have to kind of deal with that. So sometimes that conversation I find is really helpful, particularly with kids who are maybe in the teen range where they're starting to notice that difference, and then maybe some of that is being that message is being delivered to them that they're lazy or that they sleep too much or that they're um, their change is somehow negatively reflected on them. I think if we kind of normalize this biological change a little bit more, it kind of cuts down on some of that just negative perception and how we view ourselves and how our kids view themselves. And we can just kind of say, look, your body's doing what your body is doing and what it's made to do. How do we help it get better sleep and how do we kind of fix that? We talk a lot about families. Families greatly impact sleep, and this really kind of coincides with um, parental set bedtimes. There's a lot of research where it starts to talk about these kind of psychosocial or like environmental factors that impact kids' sleep. And really, it's when we look at parental set bedtimes, and we want to see parental set bedtimes that are earlier than 10 p.m. When kids have parental set bedtimes that are earlier than 10 p.m., there's a 25% reduction in depression and suicidal ideation rates. And that's kind of off the board. So I think the reality is, right, biology is changing. We're trying to push them more towards 10 p.m. If we can set those bedtimes as parents and use that parental influence and supervision and just, authority in the family, we set those bedtimes up and we find such, I mean, to me, 25% is such a significant reduction. That means, one out of the four kids that I see, I wouldn't see because they'd be getting the earlier bedtime and more sleep. Um, when we kind of talk about families, we can talk about number five and talk about the conversation of like different disparities. I put an article here about disparities within different racial groups, different populations. And really, that goes into more things that would also encompass families in terms of like bedtime routines. Do parents have solid bedtime routines with their kids? Have they had that from, and some people say, oh, that's like such a child, baby child thing to do. And the reality is, yes, you're absolutely right. And the hope is that we institute those things really early when our kids are babies, toddlers, young kids. And then we keep those things going. We keep that routine of a bedtime, the schedule of a bedtime routine or that consistency with the bedtime routine. And we find that that actually doesn't happen in some families. It happens better, more in some families and less in other families. I would say if you're a family that doesn't do bedtimes before 10 or bedtime routines, we're definitely going to talk about that as a strategy to start kind of trying to implement these things. Bedtime routines don't have to be elaborate either. I encourage all my adult patients to have bedtime routines. You do the same thing, it gets your brain and your biological, circadian rhythm ready for sleep. And so that's absolutely part of sleep hygiene. We look at like difference in education levels, different environments. So depending on um, environment, is it really loud where you guys live, right? Is there a lot of traffic happening? Is there several kids in the same bedroom? Is there people having to work out in the main room while kids are sleeping in the bedrooms? There's a reality that the environment for everyone is not the same. And so this is absolutely one of the factors that impact sleep. And how can we kind of mitigate their environment when kids are sleeping, and how do we kind of mitigate some of those factors so that it doesn't impact their sleep as much? Um, there's some interesting things about education and caregiver depression in the article, and it basically is just talking about differences in families, differences in caregivers. And we also find that when there are caregivers with depression, kids actually get less sleep. And so if you're interested in that in any way, please feel free to check out that article. It talks about that. And really what we can talk about here in a really practical, helpful way. would be if you find yourself as a caregiver with depression, or if you struggle with depression and you find that, oh, like we don't want you to feel blamed. We want you to feel like, oh, this could totally impact them. How can I help them? How can I help myself? And actually helping myself will help them, right? I worked with a psychiatrist at Rady Children's Hospital. I wonder if anyone has ever come across him. His name is Dr. Connor. He was wonderful. And one of the things that he most often talked about was if parents feel better, kids feel better, right? Because we were seeing all kids, and we also saw parents in that light, because when you see kids, you see parents. And so the reality is when um, kids do better when their parents are doing better. And so this kind of mimics that idea. The research supports that when caregivers or parents are depressed and maybe they're dealing with sleep issues, right? Kids might also have those same struggles or might be impacted by that as well. All right. I don't know if anyone has any questions so far. What I'm going to do is kind of jump into this conversation. This slide is probably going to be the shortest of the conversation, and that really is we talk about naps, right? It's incredibly interesting for me because I see a lot of teenagers and I see a lot of teenagers who take naps. And you might have teenagers that you might have kids that come home and want to take naps after school. The reality is that um, the research shows that naps disrupts nighttime sleep. If it's after 5 years old, naps will disrupt their nighttime sleep, meaning typically it impacts sleep in a negative way. They're going to get less sleep at night. The way that I describe this for people is you have like a sleep meter, right? Kind of like your gas tank. It's your sleep tank in your body. And what we find is that when kids are napping after age 5, it decreases that need for sleep, right? And so what we're doing then is at night when we put them to bed or when it's time for sleep, it's their bedtime routine, it's their bedtime. They're not tired yet, right? Because that sleep tank is not completely full or empty, however you want to look at it, right? The sleep tank is affected because they've already taken a nap. And so what I usually tell people is don't take naps. If you're sick, if there's some extenuating circumstance, obviously that's going to change things. But on a regular basis, I always say take away the naps. Removing naps will absolutely improve sleep quality or quantity at night. Um, so if you have a teenager that's napping, my argument is always no naps. They're too old for naps, and it's just making their night sleep more impacted. I've never met a kid who takes a nap and has good night sleep that's over 5. And so now I will say it is rare. Some of you might have a kid who still takes an hour nap and then they're still sleeping like 9 hours at night, 8 hours at night. And I would argue if that works, do it. But if you find that you have a child who has sleep issues and they're napping and they're over 5, take away the nap and see how that improves things, if it improves things. Okay. So we're going to go ahead and jump into this conversation. We've talked a lot about the problem. I've hopefully given you guys a really good foundation of knowledge, why sleep is so critical, what are the critical functions, all of those bullet points in the beginning, how it affects your child's academic performance and cognitive performance. Now we're going to really get into what can we do? What can you change? How can you help your kids fix this? And that's probably, to be honest, why most of you are here. Um, the reality is, there's a lot that we can do. And as parents, particularly of older kids, we might feel like our hands are tied behind our back, right? Because as kids get older, we can't force kids to sleep. We can't force, you know, excuse me, we can't force kids to sleep. You might remember when your kids were 3, 4, 5 years old. Excuse me. I have like a tickle in my throat. It's all the talking. Okay. You might remember when your kid was two, I don't know, even newborn to five. We cannot force kids to sleep, right? I have a 2-year-old now that fights naps. And she still needs one. I can tell she still needs one. But the reality is, I can set her up for sleep. I can do all the things that are within my power to do, and then it's up to them, right? It's up to her to actually sleep. I mean, we would all be banging our heads against the wall if it were up to us because it's like they're not sleeping. I can't get her to sleep during those times when I know she needs it. So that's kind of the caveat of we're not perfect. We can't control everything. We certainly can't force our kids to take the sleep when we offer it. And if you have older kids, it's a little bit like, okay, I can teach them, I can show them, I can model to them, but we might feel like a little bit, you know, hands are tied behind the back kind of thing. And I'm going to hopefully get you through a little bit of that. But the reality is we can't control whether they choose to sleep or not. Okay, so here's some of the stuff that we can do. What I would start with is if you find that you have a child who's having sleep issues, we want you to start keeping track of their sleep patterns and their sleep schedules. And so you might say, "Oh my gosh, this is a big job. Like that feels like a lot of work." It's going to be some work. And the reality is you're going to want to start a log and you're going to want to kind of monitor, right? If you have a younger kid, it might be easier. If you have an older kid, you might engage them in this process. I would say you'll have to. Because you're going to want to start asking every morning, okay, bedtime and wake up, right? How long did they sleep? Okay, do you feel rested, right? And how many nights a week has this happened? Okay, so you're just gonna start logging it. You could keep it in your phone. I know there's all kinds of like cool gadgets and contraptions. There's rings and bracelets and iPhones and just all the things that we can try to keep track of sleep. Um, I couldn't tell you whether or not you could get any of those things. That's a personal decision, whether you have the funds and the desire to do something like that. I know a lot of people really like the aloe ring. I forget the name of the bracelet. My husband had one for a while and he seemed to really like that because it kind of gives you this idea of sleep quality. Um, I don't go into that. I would rather just write it down. Take a log, ask your kids, okay, when did they go to bed? When did they wake up? Mark that down for a month, right? Start there. And what we're going to kind of start doing is noticing patterns. We're going to notice, is there a consistent pattern on Mondays they're getting really bad sleep? Or is this only on days when they're having sports, right? You can kind of keep track of that, look at the patterns, and that's going to give you more evidence to what you can do to fix it. So I would say start there. What you're going to want to do, and what I would absolutely encourage you to do, is you're going to want to maintain a regular sleep schedule. So that's going to be kind of that first thing, right? We're going to be going to bed and waking up at the same time every day, including non-school nights. So you're going to try to keep the difference between an hour. And so you're going to maintain that, right? That's going to be where you start. Okay. So we should be going to bed before 10. I would argue for younger kids, elementary age and before like 7 to 8 is kind of the magic bedtime. Um, I have this plan, and it's interesting. I'll kind of give you guys an example. Obviously, I'm a therapist. I worked with another therapist for a long time at Rady. She was older than I was and more experienced, and she had 2 kids before I ever even thought of having kids. And we used to talk a lot about sleep, and things that she noticed in working with her families and also her own family. And I can remember her telling me, you have to get your kids on a sleep schedule. And she's like, our kids go to bed. I think it was 7 for her kids as well, because it's 7 for my kids. So, and I'm like, whoa, like, I've never heard that before. Like, tell me more. And so it's like this idea that her kids, she puts her kids to bed at 7. Now, as they get older, they're not actually going to sleep at 7, right? They might kind of read or hang out a little bit, listen to music, um, you know, talk to friends, do a FaceTime, something like that. And then they're going to bed by 8, 8:30, right? So it's you have a little bit of leeway, but the reality is she's like, no, my kids are going in their bedroom at 7 and they get a little bit of time on their own. And then it gives her and her partner time to have their own time, right? Whether it's getting some work done, finishing up the kitchen, having your own enjoyment or entertainment. So there was this thing that like from the get-go with my kids, I had that as kind of a foundation that like, oh, okay, they're gonna go to bed at 7, and we've really never wavered on that. And I have friends that are like, what? Your kids go to bed at 7? Like that's insane. Um, and it works for us. And I'm not saying that you should adopt what I do. I'm just saying that you should have a regular sleep schedule. My kids go to bed at 7 and they wake up at 7. And we really don't vary at all. Whether it's Christmas or, we just tend to have that strict schedule. Maybe because my husband and I are both prior military, we have that in our bones. I don't know. I also just really firmly believe in sleep as a foundation. And this is something I would encourage is get a regular sleep schedule. If it's not 7 to 7, it's whatever works for you guys, because your bedtime for your kids might be prior to 10, hopefully, maybe 8 or 9, and then they're getting up, they have to get up at 7, they have to get up at 6. But if they have a reasonable bedtime, typically we could say, okay, even with like a leaving the house at 6:30, we're going to say at least going to bed by 10, that's 8 hours, right? So if they're in bed by 8, 9 o'clock, then they should be getting enough sleep. So going to bed at 8 or 9 might sound wild for some parents, but looking at all of this data and looking at all of this research will give you that support that you need to make a decision that's like, wow, that sounds a bit wild, but it's really important, particularly for their development. So you have to kind of figure that out for yourself. But what I would say is kids should, and according to the research, go to bed at the same time and wake up at the same time. Um, So we have a parent that shared, claims she doesn't sleep at all. Her sleep is pretty disruptive, lots of anxiety, and her lack of sleep, I assume, leads to extreme moodiness. I mean, I'm so sorry that she's dealing with that because it sounds so, it's problematic, right? When we don't get sleep, um, anxiety is, we know it's increased, right? We know that depression skyrockets. We know that suicidal ideation increases. We know that all of these things, um, you know, make an impact. And I would say if she's still having this kind of sleep and it's not better and you've tried all of these things, my best recommendation would be go to the pediatrician and get their opinion. And we really want to say, look, this is not getting better. We've done a lot of sleep hygiene stuff. We've taken the recommendation of a therapist and we've done this, and this. And it's not different because what we look at when we look at clinical diagnoses and things is sleep function, right? If it's impairing a biological function in terms of sleep, that it means there's something else going on. So I would say absolutely uh, go to the pediatrician. Um, And I think that one of the other questions is the pediatrician or psychiatrist would definitely make a determination on medication. Um, what I will say is sleep medication is not a good long term. A psychiatrist will tell you this. Sleep medications, and I'll get to this in the PowerPoint, they're not a good long term solution. So if we're talking about sleep medication, You obviously have to talk to the doctor about it, and at the same time, there's likely other factors, right? The other things that are happening that medication won't fix. And once those other things resolve, the sleep resolves. Um, okay, and that's super interesting. How old is your daughter? Okay. Um, Now, I would argue at that point, if she co-sleeps well, but she's not sleeping well on her own, and her sleep is really disruptive, and there's a lot of anxiety, I would say, what's her treatment of the anxiety like? And I would go that route probably. Um, and I think while I say sleep medications are not a good long-term solution, there are other medications that obviously impact those things. Um, Yeah, and that's incredibly hard. So what I would argue too is the person won't be a stranger once she gets to know them, right? But she has to give that person a chance. So that's more of a conversation, and it might be something that you kind of have to push. Because to me, that means there's kind of something else going on, and I would want to treat that. Yeah, so what step you would take next is you would want to probably look for a therapist that would be covered with whatever type of insurance you're looking to use. And the best thing there is the pediatrician. That's kind of disappointing that they didn't offer anything. Typically, they'll say, "Oh, well, like we know of this person, or we could even do a psychiatric evaluation if things are not getting better with sleep hygiene and things like that." But I would say do some research with your insurance, whatever you're trying to use. You could go on psychologytoday.com. You could go to your insurance directly and ask for a list. A lot of them will have a provider list that's covered by your insurance. And then you just kind of have to go based on where you are, your zip code. And then what we would be looking at is somebody to kind of get to know her and give her that space to like get to know the person. And then we would really probably want to treat the anxiety. That's what I would say. Great. I'm glad that you have that. The insurance will really help. And yeah, I would say start there, especially if the pediatrician was not of great help. Okay, I hope that was helpful and maybe helpful for other parents too. We kind of have this tree, right? If you've already tried a lot of these things and it's not working, there might be something else going on. Okay, let's keep jumping in. So, we talked a little bit about sleep schedule, right? Going to bed, waking up around the same time, including non-school nights. I talk about being consistent on weekends. This is so hard, I recognize. Teens obviously can stay up a little longer, right? But they shouldn't sleep in to catch up on sleep they missed because it does not work that way, right? Your sleep tank will not suddenly be magically better off if we sleep a bunch on the weekend and then we're sleep deprived all week. It just also makes it harder to get on track with that regular schedule, right? And we find that kids like really loading up on sleep on the weekends or adults, right? It has greater risk than benefit. So I would say be consistent on the weekends. I know it's really hard. I know a lot of parents are like, look, they can just sleep all weekend because they haven't had a lot of sleep. It's also kind of helpful for me. I can get some things done. With that decision, it will affect their sleep because it's going to be harder for them to get back on track. I have seen countless kids who are in high school who they already kind of have a wrecked sleep schedule, right? And if they're really messing that up on the weekends or during breaks, right? When they go on winter break or they go on summer break, it's just so hard to get them back on a schedule. And I find that for most, if not all kids that I see, it typically getting that extra sleep has a way worse outcome than just powering through it and saying, no, I'm not going to sleep extra. I'm going to just kind of stay on track. That it offers better sleep outcomes than the alternative. Uh, well, another one that's really important for parents, right? We talked a little bit about families and how families can either help or hinder when it comes to sleep. What I would say is, as part of sleep hygiene, we want to create a sleep-friendly environment. So this comes down to like bedding, right? Comfortable bedding. You're going to minimize light, whether that's blackout curtains, blackout shades. We're going to reduce noise. That might sound like a noise machine. It might sound like having a fan on, something to drown out outside noise. If you have a small home, like I do, maybe a lot of us do in California, we use noise machines for our kids because there's just simply too much noise, and we find that our kids sleep a lot better with this kind of ambient noise. Now, you obviously want to make sure there's no lighting. You want to make sure that it's kind of a soft, comfortable noise, something that they can enjoy. Um, if you have kids that share rooms with pets or other kids, we really want, okay, keep the pets out of the kids' rooms. Those are sometimes disruptive. They're waking up, they're making noise, they're kicking, they're taking up room. If you have the ability to separate kids, I always recommend that. I think that with space being a limitation, particularly where we live, I think it's really understandable for kids to have to share rooms, but you might have to do that the noise reduction, the noise machine, making sure that it's really dark, cool, and quiet in their room. I always tell families, that kind of goes along with the next bullet. Comfortable, cool, quiet, and dark, right? If it's warmer than 75 degrees, it can be harder to fall asleep and stay asleep. And the opposite, if it's really much colder than 60 degrees, you'll find the same thing. So we really want to make sure that we have this optimal physical environment. And I'm gonna kind of go back and forth to the chat to make sure I'm answering everybody's questions. Oh, nice. Okay, there's a parent that loves the noise machines. Okay. Um, yeah, noise machines can really come in clutch if you've got like a noisy neighborhood or just like other things happening in the house. It really cuts down on them waking up. Okay. So we've got that kind of like external environment. I don't know about you guys, but I switched to I think a lot of sheets are typically, if you look at, I don't know if anybody looks at this. For me, I switched all of our sheets to cotton sheets versus polyester sheets. If you look at like microfiber sheets, kind of the typical sheet, if you look at the composition, the fabric composition, even that made a significant difference in my kids' sleep because they had a breathable environment, right? They didn't have polyester can get very stifling and it can trap body heat, making you overheat in the night. So if you have that problem where you're finding that you're not sleeping well because you're getting too hot or your kids are complaining of being too hot, I would really look at cotton or linen. Linen's quite expensive. You could stick with just cotton. They sell 100% cotton at Target and Walmart. And it will change. It changed a lot for me and my sleep, and just the ability to have a breathable environment, which makes it more comfortable and cool while you sleep. That's just kind of a little side tip that I have noticed makes a difference. Um, this is when we start talking about sleep hygiene is the bed should only be used for sleeping. So what we want to encourage our kids, maybe even this is a thing for their bedroom, right? Getting them a space to where their bed can be only used for sleeping. We don't want them to do homework in their bed. We don't want them to like do other things, right? We want to do those other things elsewhere. A lot of times I tell people get a small little bean bag or a small little chair, something in their room where, or a desk, right? They have a place to do their work, or they're reading or they're watching or they're, TV shows, and then they have their bed, which is only for sleeping. Now, a lot of people are like, does that even really make a difference? The reality is your brain forms associations. And so very often when we start doing other things in our bed, the association for your brain is, oh, I'm going to do this thing, right? But if you have a bed where you only sleep in, your brain is like, nope, I know exactly what this means, right? This is where I sleep. I don't do anything else in this, I sleep. And so if we can create that really strong physical association in our brain, the bed is used for sleeping. It really helps us to fall asleep quickly and stay asleep. So that's kind of an important one if you have a kid who does things in their bed or you're one that does things in your bed. Um, Try to look at other options, whether it's getting some sort of off, little desk space for them outside of their room or in their room, whatever you guys have space for, or simply, like I said, a little bean bag, a little area where they can read or kind of chill, and then they've got their actual bed where they're only sleeping. Okay, we already talked about keeping a consistent bedtime routine. But with a little bit more detail, we tell people that part of your bedtime routine, we talk about like babies and kids, right? It should be the same. It can be 5 minutes long, 10 minutes long. It doesn't have to be this drawn out thing. But what we want to do is keep a consistent routine. We wind down by doing less stimulating things like reading, listening to calm music, meditation, progressive muscle relaxation. We don't watch television. We don't cram in more studying. We don't talk on the phone or exercise, right? These are all like activating things. And what we want to do is shut everything down. So a lot of times for teenagers or older, adults, I say just get some sort of routine, right? You go in your room, you either take a shower or you brush your teeth, you put your pajamas on, you might do a little skincare, you might brush your hair, you might do a little relaxing, like short massage, whatever it is, you're going to do the same thing every night. It could be 5 minutes of winding down, brushing your hair, doing your skincare, but you do it every night the same. Okay. So I'm kind of throwing out ideas. Your kids might have ideas. For younger kids, you're going to maybe read a chapter of their favorite book in low, low light, right? And then we're going to say our good nights and then we're going to leave the room or however you do this wind down, right? Once it becomes repetitive and consistent, our kids expect it, and more importantly, there's the association in our brain with I'm in my bed, I've done my nighttime routine, now it's time for sleep. And it's so incredibly important. It makes such a difference that we actually do that, do the bedtime routine. Mm. Annie, are you guys still seeing my screen?
Yes, we can still see it.
Okay, great. Mm. I'm sorry, I'm having like a technical difficulty where I can't pull up the slides on my own screen. I think
You
sorry,
want
give
to
me just
stop sharing and then share back and see if that helps?
yeah, because I'm not sure how to get out of this. All right. Sorry, guys. Um, okay. So more things that we can do in order to help our kids with sleep. There's a lot of research that supports movement, incorporating movement, right? We talked a little bit about this earlier, but the more we move, the more our kids are moving, the more of that energy gets spent, the more fatigued they're actually going to be, right? So we're going to incorporate, and it could be anything. It doesn't have to be strenuous exercise or cardio exercise. We're just talking about movement, right? Um, we want kids, whether, okay, they're in school, they've got a little bit of movement, maybe we take nighttime walks, or we are doing nighttime yoga with them, or we're doing something where we're getting them to move. We take bike rides. We want to just get kids moving because this is going to help them sleep better. If this is incorporated into your daily routine, right, this is the consistency that we're looking for. Um, Part of this is like taking a break, going outside. We want you to get outside time or kids to get outside time sometime every day, especially in the morning if it's possible. I think this is probably more doable for adults because we have more control of our morning routine or of our mornings in general. There's a lot of significant evidence that talks about sun exposure, particularly in the morning, and getting it into your eyes that helps your body keep the internal clock on track. If you're interested in this for any reason, like I am, Dr. Andrew Huberman is a neuroscientist and he does a lot of really good YouTube videos about that exposure, the sun exposure in the morning in the peripheral of your eye. And so that might look like for us, where we can control it is morning walks, right? And we're really getting that sun exposure first thing in the morning. We can kind of consistently do that. The reality is that is keeping that circadian rhythm and internal clock on track, and it just means we're going to sleep better. So that he has some interesting videos. If you guys are interested in that more, the circadian rhythm, and particularly with kids too, who are having that switch in the circadian rhythm, if they're getting outside in the morning and getting some of that sunlight into their eyes. Obviously, we're not talking about looking at the sun. We're talking about having the light of the sun, ambient light in, you know, the sky. He talks a lot about looking at the horizon, right? So if we can see the horizon and we're getting some of that light into our eyes that way, we're not looking at the sun. We all know how bad that could go. Um, Making sure kids the proper nutrition, they're eating regular meals, they're not going to bed on an empty stomach. We also don't want to eat full meals before bed, right? If your kids need a snack before bed or they're hungry before bed, I always opt something really light. Carrots and hummus, pretzels and peanut butter, something light and small. And actually, I don't know if you guys know this, but peanut butter actually has some of the similar chemicals that turkey has in the sense that it helps you sleep. I don't know if you guys have ever tried that. I love peanut butter and I eat it at night. It actually really helps um, get you into that kind of nice state of sleep. Um, we talked a little bit about this earlier in terms of sleeping pills or aids, right? I don't, this, any psychiatrist will tell you this. Sleep aids, including supplements like melatonin, including sleep prescriptions like Ambien and other things, these are not good long-term solutions, meaning they're not effective long-term and they're actually detrimental to sleep if used long-term. So we want to avoid caffeine. Obviously, we're talking about kids, but teenagers, right? Caffeine, alcohol, smoking, sleeping pills, aids, or supplements. Those things are all going to negatively impact sleep. I think it's fairly known about caffeine. I don't know that alcohol and smoking is as widely talked about, even when we talk about adults having wine at a glass of wine or like a beer, right? That's going to actually impact your REM sleep. And a lot of people don't recognize it's like, oh, well, it takes the edge off and it kind of makes me sleepy. But it actually is going to negatively impact your ability to go into consistent REM cycles when you're sleeping. When we talk about REM cycles, those are the cycles in which the most of the restoration and memory consolidation happen. And so a lot of people find if they're having like a daily nightly drink or a nightcap or whatever, you start noticing some of those same symptoms as sleep deprivation, right? Stronger symptoms, particularly when we talk about memory consolidation and cognitive function. Okay, So as we kind of start wrapping up, I am going to try to give some time for questions at the end. But some of the key takeaways for tonight, my hope for you is um, one of the key takeaways, the strongest, biggest things I want you guys to understand is that intervention during early adolescence actually has a super important a prominent effect, okay? And so the reason behind that is because sleep is habitual. If we intervene earlier, right, when kids are younger, we have more likelihood that we can change that into adulthood. If kids are already establishing these routines of sleep or the impacted sleep, that transitions with them into adulthood because it's habitual, right? We know that, like I was talking about sleep association, when you have this kind of habit of not doing a bedtime routine or doing other things in your bed, that goes with you. And so the important thing is the reason why we are so passionate about this, I'm so passionate about this, is because we can intervene now and we can affect things greater, right? If we intervene now and we get our kids help with sleep earlier, which there's no time like today. So that is one of the key takeaways. We can fix this. It's better to fix it early. So if you find that your child has any of these issues, hopefully some of these suggestions and strategies will help. And if you have any questions, throw them in the chat. I'll try to answer them when we get done with this slide, but it will have a really valuable effect on their sleep as they age. Um, Another thing that I want people to take away, because as parents and as people in the education system, we can assist with systemic change, right? We talk about there's a lot of schools in San Diego and in California went to later school start times. They've also put more limits on homework loads. These have positive impacts on sleep duration and sleep quantity, sleep quality, and academic performance. So the reality is, as parents, we can be armed with all of this information, and then we can take that to our schools, take that to, where we can make change and talk to school boards, talk to educators, and say all of this stuff helps, and we're all kind of in it together. We're working together. Um, One of the other key takeaways would be parents absolutely have a role to play in healthy sleep, even when your kids are in high school. And most of that is setting appropriate bedtimes, modeling appropriate sleep hygiene and behavior. And the most prominent, I'll have a whole talk on this, helping adolescents get screens out of their rooms at night, because that we find is currently one of the biggest limitations when it comes to kids sleeping. I think I do a talk on like social media and technology, and I'm not sure what the data is. Maybe Ani can share that. But the reality is, right, we as parents have the power in that way to say, look, I'm the person that's tasked with your safety and with your ability to learn. And so, taking away the screens at night is going to be controversial. It's going to be a struggle, and yet it's going to improve sleep outcomes. It might give us the power and the kind of like push that we need to put more limitations or more boundaries in place. I talk a lot about a takeaway tonight should be like your adolescent, your student, your child should be a part of their solution, right? You can give them this information, you can teach them about what you learned. What we want them to do is they're going to make these decisions on their own, right? In a couple years, depending on their age. And so what we want them to do is have the information to make their own choices so that when you're not there, right, that habitual thing that they've created is good. They get a good sleep schedule. They get good information on how to set up their environment. They get the importance of reducing screen use at night and how to wind down. Because obviously kids are also more likely to engage in these rules and boundaries if they agreed and set them up themselves. So I think depending on your child's age and kind of temperament, right, you can have them be a part of the solution. You can talk to them about it. And I would strongly encourage you to do that. Hey, like, how can I help you get better sleep? Hey, I'm noticing that, you're telling me you're not sleeping. Like, let's fix it together. I have ways, right? I have ideas. What do you think will work? How can I help you as your parent? What can I do to change your sleep or to help you fix things? Be a part of the solution with them, have them be a part of the solution and like collaborate on that. I also really became passionate about putting pressure on. Now, this might seem far out of reach for a lot of parents, and maybe not, but as parents, being armed with the information again, right, and the confidence to put pressure on tech companies to be a part of the solution, right? Enabling nighttime turn off periods so that kids can get sleep. Um, wouldn't it be great if like all social media shut down for adolescent, anybody under the age of 21, from 8 to 8 or something. I'm thinking in terms of like what's healthiest for kids, and I get that that's kind of extreme and that might sound undoable, not doable. But really, we just want parents to be like, hey, you have the ability to use your voice. You have the ability to, in lieu of a tech company changing it, we can do it, right? I always tell parents, put a timer on your Wi-Fi. Um, that it shuts off at 10 p.m., right? If there's no Wi-Fi, they're not using it, right? Now, the other thing is like, do they have a cell phone? Okay, we're gonna have to turn that off, create a tech box, put it in the parents' rooms. That's where everything's getting charged. You take chargers, you manage things in whatever way you can. But the reality is we can set things in place so that the whole family has this like healthier relationship and we can all kind of be a part of that solution to get better sleep and each one of us like model that to our kids. Let's see. All right. That is all of my information. I am going to leave Ani and my information on the screen. If you have questions or comments about the presentation, trying to get back to the chat so I can see.